When can carbs be beneficial in cats with renal disease? I would like to talk about the role of carbohydrates in cats with kidney disease. When a cat is diagnosed with renal disease, we know that restricting dietary phosphorus is the most important thing we can do to prevent the progression of the disease. When we think about our food ingredients, protein contains way more phosphorus than either fat or carbohydrates. So in order to reduce a diet in phosphorus and reduce protein, we have to match the rest with either fat and or carbohydrates. Now, cats are obligate carnivores, so it's easy to think that fat is the obvious choice. But we have to keep in mind that feeding a really high-fat diet just to bring the protein down doesn't always work for all cats. In fact, in cases of cats with chronic enteropathies, so gastrointestinal signs, or if they have pancreatitis, in these cases, actually feeding a little bit of carbohydrates to create a more balanced diet is best for them. Chicken thighs with skin on is a common ingredient recommended for cats with renal disease. But how much fat the skin on provides can actually drastically affect the amount of protein that's in the diet. I took 2 chicken thighs from the same package to see what ratio of skin to meat I would get from each of them. So for the first thigh, I got 25 grams of skin and fat and 133 grams of meat. This has a macronutrient breakdown that is just above 50% energy from fat. For the second thigh, though, I got 41 grams of skin and fat and 109 grams of meat. This gives me 65% energy from fat. Now compare this second thigh to the average mouse, which has a more moderate fat content. So this is a pretty high fat diet, and it may not be appropriate for all cats with renal disease if they're not fat tolerant. This is where carbs can have a beneficial role by moderating the fat content. Comparing the 2 thighs also highlights that the ratio of skin and fat to meat is not consistent. So be cautious about this if you're trying to target a specific phosphorus content because of hyperphosphatemia.